Hello everyone, my name is Sofia and today I'm going to have an interview with Dr. Gerald. We are going to talk about liver disease.
Thank you, Sofia, for welcoming.
So, could you please tell us what are the common causes of chronic liver disease?
There are various causes of chronic liver disease, Sofia. The most common being a hepatitis C infection worldwide. Almost 26% of all the cases of chronic liver disease are contributed to hepatitis C. The second most common cause of hepatitis or this chronic liver disease is alcoholism. Almost 21% of the cases of alcoholism turn the cause of the entire chronic liver burden is because of alcoholism. So then there is various kinds of viral hepatitis like B, E. They are also responsible for chronic liver disease. And then various things, there are various cryptogenic causes for cryptogenic means related to treatment, like the various kinds of treatment can lead to liver damage. Like the most common example for that is Tylenol, if you all know, acetaminophen, which is one of the major contributors of acute liver damage. And there can be miscellaneous and genetic causes of chronic liver disease.
What are the main symptoms of having this liver disease?
Again, the most common symptom of having a liver disease is jaundice. Jaundice is nothing but basically discoloration of your sclera. Sclera is the tissue behind the eyes, and this leads to yellowish discoloration of sclera, plus it can lead to yellowish discoloration of the mucous membranes. The second common symptom is abdominal swelling. Abdominal swelling is basically because of ascites. Ascites is nothing but filling of fluids inside your body cavity. Inside your stomach, so inside your abdomen, I would say. So the third thing is itchy skin. Itchy skin is because of hyperbilirubinemia, because the bilirubin levels is high, so it can lead to itchy skin. That is also a very common symptom of liver disease. Then discoloration of urine, dark colored urine is a sign very persistent with liver disease. Other signs of liver disease are chronic fatigue, nausea, vomiting. People can have easy bouts of nausea and vomiting, and loss of appetite and tingling sensation in the body is also a sign of liver disease. Again, that is because of hyperbilirubinemia.
Besides excessive alcohol intake, what other substances can cause liver disease?
Sophia, besides alcoholic intake, as I already told, the most important factor is the viruses. Various kinds of hepatitis like hepatitis A, B, C, D, E, they can lead to liver diseases. Second, cryptogenic causes, this is our iatrogenic causes, are also very important in liver diseases. Various drugs can directly damage the liver. So these are, and other causes can be congenital causes are also there for chronic liver disease.
Is hepatitis a form of liver disease?
Hepatitis is basically inflammation of the liver only. Hepatitis can have various causes. Hepatitis can be, most commonly is a viral cause. As I already told, hepatitis viruses can be A, B, C, D and E. There are 5 kinds of viruses which can cause hepatitis. The second thing is autoimmune diseases can also cause hepatitis.
What is the name of late stage chronic liver disease?
The name of a late stage chronic liver disease is called cirrhosis. Cirrhosis is nothing but scarring of liver. Whenever we do have excessive hepatitis or fatty liver, eventually it leads to scarring of liver, and that is called as cirrhosis.
Which important functions are affected by severe, acute or chronic liver disease?
Because of damage to liver, either it is acute or chronic, the various functions are affected. First is basically bile production. So liver basically produces, one function is to produce bile, so that is impaired. The second function of liver is to filter out the toxins out of the body. So if liver is damaged, these toxins will not be filtered out and will accumulate in the body. And the liver is also responsible for synthesis of various clotting factors. So once the liver is damaged, these clotting factors are not synthesized, and excretion of bilirubin is also one of the functions of liver. So that is not done, which ultimately leads to hyperbilirubinemia. Then various vitamins such as A, D, E, K are mainly stored in liver. So liver is damaged, so it leads to deficiency of these vitamins in the body. And other role of liver is metabolism. So once the liver is damaged, it ultimately can lead to death because of cirrhosis.
Can a liver damage be reversed?
Sophia, the answer to that is yes and no. Again, that depends upon the stage of the liver disease. There are 5 stages of liver disease. If it is not cirrhosis, yes, partially it can be repaired, or sometimes in few cases fully it can be repaired. It is a reversible thing. But once changes of cirrhosis and scarring of liver occurs, it's very difficult to reverse it on its own.
And how long can I go on drinking alcohol before it affects my liver?
That is also one tricky question, because that also depends upon your luck, but otherwise the recommended doses of alcohol are very less. But they say if you drink 8 ounces of beer or of wine a day, you can continue it up to 20 years.
And what causes hepatitis?
Sophia, as I already told you, there are various causes of hepatitis. The first one and foremost one being viruses. Various kinds of viruses affect liver, particularly like hepatitis viruses. The second cause again is alcohol, that can lead to hepatitis. And then again, autoimmune hepatitis is very common thing. Then there are various drugs such as acetaminophen, and which can directly lead to hepatitis.
And how important are the hepatitis vaccines?
Hepatitis vaccines are not available for all hepatitis viruses. Hepatitis vaccine is basically hepatitis B vaccine, which is available. Hepatitis A vaccine is available, but right now we don't have a vaccine for hepatitis C. So if you are suspecting, or if you are in an area where you are having more chances of getting hepatitis, I think everyone should get vaccinated for hepatitis B and A. At least we save what we can.
Are there any herbal medicines to treat liver disease?
So there are various herbs which have been found to be beneficial in liver disease. The most common being milk thistle, if you have heard of. It is one strong antioxidant. It protects liver against various damages. The second one is jinseed, which is basically has anti-inflammatory properties, and again protects liver from damage. And green tea is one thing which we all know, and it is found to be protective for liver damage. Then licorice is a substance which is predominantly helping us out in protecting liver against alcoholic damage. Then turmeric, because of its very high in anti-inflammatory properties, is found useful in liver damage. And garlic, ginger, these are the substances found to be having anti-inflammatory properties, so they are effective in liver damage. And dandelion and ginkgo biloba, if you have heard of, these are few of the kinds of herbs which have healing power for the liver. Astragalus is one more herb which is basically a protective against oxidant damage. So these are the herbs which are found effective in the liver damage, and most of these herbs are basically a part of liver care disease kit we have. It's basically used to protect liver against various oxidative kinds of damages, and it's available at ACA.
And what is the duration of this treatment?
The typical duration of the treatment depends upon the stage of the liver disease. It is usually 3 to 6 months, but if it is an advanced liver disease, you can take this treatment for a longer period of time because there are no side effects for this herbal treatment.
Thank you, doctor, for joining us today and giving us so much information about liver disease. Now we know how much herbal treatment can help us out. In order to receive this treatment, you can contact us at the below mentioned number or order directly from our website.